review. So I will guys give you the highlight of what you can expect for your exam. Coming from perspective of someone who has been doing this since 2015. So this is my 16, 17, 18, 19, 20. This is my 8th year. I'm turning 9 years of coaching for the PMHNP review. So I want you guys to make sure that you're in good hands. I will give you guys vital information for those who do not understand how the exam works. Remember, you're taking the ANCC exam, which is 175 questions. And I'll give you guys the breakdown later on how you're gonna narrow your topics. I know there's a lot of information out there. There's your purple book, there's other review programs, but what's unique with us is that we cram all the information and make it concise, clear, and readily available to you. So another update is that by January 2024, you could be board certified also in AANP. So it's not only ANCC now, but we also have AANP. But the question is, should you take both AANP and ANCC? My answer is that you only need one to practice. But some clinics or hospitals, they prefer ANCC due to the magnet status, but some prefer AANP. The same thing when me, as being a family nurse practitioner before, I took both, so ANP and ANCC. So my passion for teaching started 2008. I started teaching at CNA program, LBN program, RN program, and then I did my NCLEX review, FNP review, and then now specializing with Psych NP review. So there's so much needs for this. I want you guys to get more information on how you can navigate your exam. I know some test anxiety because this exam is 175 questions, and it's like finalizing all your curriculum, and you need to pass this to practice. So what we did is to make the program more student friendly. Number two, clear in your understanding that the test is really doable. Okay. So if you have some friends that didn't make it or did not prepare well enough for the exam, I just want you guys to remember that there's help, and there's also a time for them to redo the exam, because this exam will actually test your knowledge as a entry-level competency PMHNP. So what do we mean by that? They don't expect you to be the best psych NP, but they have to have at least a good understanding of your 5 domains, which we're going to discuss today. Okay, so by profession, I started my own practice. Also, I'm a family nurse practitioner and also psych NP. Been in academe once again since 2008, and I understand that from an anxious student or from a test anxiety standpoint, we really need to make sure that we address that before you take the exam. Okay, we want it to be stress-free. We want it to be a learning environment wherein you sit for the board and you're actually ready to test. But first, remember there's a process and there's a system. Okay, it's not just one time that you're gonna prepare for this, that you're gonna read the whole purple book in the last few days of your exam, then you're gonna sit for the board. Cramming for your exam is not helpful, so you have to prepare for this. Okay, my suggestion is at least 30 days of serious studying. You need to make sure you prep for it, and the last week will be finalizing your scales and finalizing your medications, because they're big on medication scales, screening scales like PHQ-9, your GAD-7, and also they're big also on your psychotherapy. Okay, psychotherapy covers your EMDR, CBT, your ABA, Applied Behavioral Analysis, your dialectical behavioral therapy, and they're also big on structural family therapy approach, which we're gonna discuss as we go along. So once again, more informational and giving you test-taking strategies. So one of my students said some of the questions that you can encounter probably in your exam may mean that you did not read them at all, or you did not encounter them in your school, in your practice, because there are some pre item or test questions that are only there to throw you out or to give you a challenge question, which are non-scored. Remember, you only need 350 points to pass this exam, okay? So 350 out of 500. So if we look at it, they're only looking at a 70% standpoint for you to pass this exam. But you have to be good in the 5 domains, okay? Next, how important is task taking strategies? Remember, this is the most important piece of the puzzle when you're testing for the exam, because number one, without a good task taking strategy, some questions that you can encounter may be long and difficult, and it's harder for you to find the keywords and strategy with removing two options. Remember, in a multiple choice question, it's really important to identify keywords, what their age are, what their race, what is the question really asking you is really important. And then number two is the stem of the question. What the question is really asking you is really important. Like, for example, is it asking you for a priority for someone who is in crisis? Is this a question that is asking you, what will you do with a patient that has symptoms of low blood pressure, low heart rate, low potassium level in the clinic, and they have an eating disorder? Are you going to send them home, or are you going to arrange hospitalization for this patient? So remember, we are PsycNP, we are autonomous in the clinic. We we can decide what will be good for our patient, but the most important thing is also focusing on the patient's standpoint, specifically safety concerns. Okay. So once again, I want you guys to remember keywords, stem of the question, and then number three, your opposition. So what do you mean by opposition, guys? When there are two options that are opposite, one of them is the right answer. Okay. So they will tell you report to the CPS. So if you think that this is a case of a child abuse, of course, we don't hesitate to report it to the we expect it not to ignore it, but report it to the CPS. What else? Report to the CPS, not report to the CPS. One of them could be an answer. Or this could be a case that someone got sodomized at home, like the brother sodomized his sister, and now the mom is calling you, hey Joyce, I can be my son sodomized my daughter, what will I do? So you have to really know what the protocol is. Number one, you have to make sure you separate the victim from the perpetrator. And then number two, make sure to always stay with the client. And number three, call the CPS. So they want you two guys to know what your priorities are as PsycNP, and how to go over that is to making sure that they're safe, they're removed from the imminent danger. And then number three, always stay with your client, especially the ones that have experienced the incident or the trauma. What else? Opposition stands for high TSH level and low TSH level. So they could give you, if I am on lithium for long-term use, what do you expect in terms of my thyroid stimulating hormone? So I've been on lithium for 10 years, 20 years. You will expect that their thyroid stimulating hormone will be higher than usual, because lithium is harsh on our kidney, in our thyroid. So if you check the thyroid stimulating hormone, it will only signifies that they have affectation with your thyroid gland, and then making sure that you constantly monitor that, because there's medication that could help your patient out. But remember, you're a PsycNP and you're not an endocrinologist. You always do a referral in cases like this. I know sometimes we could be faced with questions that are asking us to adjust the dose for your medical aspects, like treating your infection, like starting antibiotics. What else? Culturing a wound. We don't do that. What else? Telling your patient to adjust their erythromycin, their Bactrim. Of course, that's not within our scope of practice. So always stay on your lane. You are taking the PsycNP and not a family nurse practitioner or acute care nurse practitioner. Okay. So once again, task taking strategies is what I'm going to give you today, and also how to read into the questions. So we'll do, guys, a workshop on how to read the question, how to remove two options, and how to choose between two potential answers. When reading your question, remember, pay attention to the keywords. So what are the keywords on Joyce? We are looking for, is the patient Hispanic? Is the patient Native American? Is the patient Asian? So one thing that you can identify is their race, because some race guys have a predisposition for certain disorders. Am I correct? Like for example, I'm Native American Indians. I'm prone for suicidality, and the reason for that is that most Native American will resort to alcohol or will resort to opioid abuse. So basically, you will always assess safety concerns for this patient. Next, your Hispanic patients, they believe with what? Herbolarios, they believe with mal de ojo or evil eye. So you always need to validate and accept that they have a belief, right? That they have this culture aspect that you need to respect, and that's important. The next one is your Native Americans. So when there's given a race or nationality, Native American Indians, sometimes they can ask you about a healing stick. Remember, if it's a healing stick question, you always need to make sure that you're doing cultural competence to the staff that takes care of the patient. Okay, I want you guys to remember that if they believe with the healing stick, we have to respect that. And don't just take them out because you think that they're gonna use it as a weapon. If they don't have any history of being assaultive, being being aggressive, or the question may tell you that they want the healing stick to be inside their room. And don't overthink that, hey, this healing stick will be used as a weapon, they're gonna hit the staff, they're gonna hit the patients. So remember, don't overthink or don't ask what if. It's really important, guys, that when we do healing stick question, number one, we educate the staff. Number two, we always focus on respecting their rights as a patient, and we don't invalidate their feelings. Just remember, if you are the patient, how will you feel if we try to remove a personal belongings to you? Or if we try to ignore your culture, then that's something that you need to pay attention to, okay? And the next, do not skim over the words or read them too quickly. So this is the most common mistake of students taking this board. Remember, if you skim too quickly, what's going to happen is that sometimes you miss the details of the question. So you have the capability to highlight the options there, guys. Okay. When you're reading a question, and you can have the experience of reading in between the questions or reading into the questions can be a trap for you to fail this exam. So make sure know the age, know the situation, know where they at. It could be an inpatient question, outpatient question, or it could be outside the clinic, or it could be a question that pertains to safety. Okay, so you always need to make sure to identify what is being asked. Okay, so once again, strategy keywords is number one. Okay, next, avoid analyzing the question, and this is pretty much the most common trap when you're taking the exam, guys. Okay, respond to the question using only the information given by the examiner. So the ANCC will give you the details, and you need to decode what is being asked, but you don't need to make assumptions, okay, or adding additional details. So these are things that will allow us to fail the exam because we tend to read into it. Like, for example, they're just asking you, are you going to allow the healing stick inside the inpatient room? And you're overthinking, oh my God, they're going to use this as a weapon. Oh my God, this patient will be suicidal. Without a good assessment, then you can't just conclude, because it will not be good for you as a psych NP to conclude or to stereotype patients. You can't just say all patients will be suicidal, right? All patients will be what? Um, all patients will commit suicide, or all Asians will be prone for this certain disorders. Okay, so you need to make sure you look at the details, you look at what is being asked. If it's Asian and they have a carbamazepine question, so you need to make sure that they are prone for Steven Johnson syndrome, which we need to screen. It's just running the genetic predisposition called your human leukocyte HLA, or human leukocyte allele, which is found in Asians, Filipinos, Chinese, Koreans, are prone for more Stevens-Johnson syndrome their due to the genes or epigenetics that is passed on. Okay. So next, read all the answer choices, and we're gonna make sure to help you out analyze the best answer choices. Remember, in A and CZ, 4 options, 2 distractors, and then 2 possible answers and 1 best answer. So remember the rule of 2-2-1. You remove 2 distractors, you choose of between the 2 potential answers, and you choose the best answer. So once again, your formula for your exam is 2-2 and then 1. 1 best answer because it's a multiple choice question. There's no select all that apply. There's no true or false in this question. It's 175 questions, multiple choice. But out of 175, 25 guys are non-scored. So that makes 150 questions, okay? So once again, 25 is non-scored in your exam. So you don't know though which are non-scored. So they don't tell you exactly what are non-scored. But for me, the non-scored ones are the odd questions. Number 2, they may be questions that only are there to validate if this is a true knowledge or if this been faced in the clinicals. So once again, 150 questions and you need 350 points. Next, partially correct answers are not the correct answer. So what do you mean by partially correct answer? So they will give you like what? Probably vital signs that is incomplete, while the other one is more complete, and they have LOC. They also have what? Level of consciousness is LOC, and they also have ammonia level, okay, or depakote level. So what do you mean by that? If you are given an option that talks about a medication and you need to monitor if they are hepatotoxic, probably they are on kava and they are on Depakote, and now they took alcohol. So that's triple agent that causes hepatotoxicity. So partially correct answers may mean letter A may be vital signs only. Letter B may be vital signs, check the LOC and check the ammonia level. As we all know, ammonia goes to the blood-brain barrier, causing you to have encephalopathy. So that's something that is a complication of medications that are hepatotoxic. Okay. So when we say hepatotoxic, guys, they are damaging your liver. Depakote is one. What else? Your kava, which is a herb that reduces anxiety for our patients, and then benzos are hepatotoxic. So choose an answers, guys, that is complete, that is not only telling you a piece of the puzzle. Okay, and then letter D says assess the skin. So remember, when you are faced with options like this, you are given a hepatotoxic medication, always choose the longest answer and the ones that is complete. So what is the strategy of this umbrella? So if A is correct, C is correct, and D is correct, because we need to assess the skin. If they have jaundice due to hepatotoxic agent, then you choose an answer that is the longest out of the equation. Okay. Next, narrow options to 2 possible answers. We mentioned the ruling of 2-2-1, 2 distractors, 2 potential answers, and 2 PA, and 1 best answer or 1 correct answer. So always remember that these are important. Okay. Narrow 2 possible answers. So when you're testing, guys, you will already observe what are distractors and what are potential answers and what is the best answer. Best answer, once again, is concrete, concise, clear, straight to the point, and also gives a finer detail about the patient. Okay, remember that. Next, when 2 answer choices are the opposite of one another, and we discussed this, your third strategy, guys, is opposition. So once again, make sure you know your opposition. One says leave the patient alone. Number 2 says stay with the patient. Then probably it's stay with the patient if they have panic attack or anxiety. The other one is report to the CPS, do not report to the CPS, or ignore the situation. Then that's an opposition strategy. One says hypothermia, while other says hyperthermia. It's one or the other that could be the potential answer. One says neuroleptic malignant syndrome, and one says serotonin syndrome. They could be the opposition strategy. One says elevated blood pressure, one says decreased blood pressure, then one of them is the correct answer. One says a longer half-life, one says a shorter half-life, then practice opposition. One says rapid absorption, the other one says slow absorption, then you always choose the rapid absorption, right? If it's talking about a medication that will help you absorb the medication, specifically Cialis, Viagra, or your PDE5 questions. Make sure, guys, you know your PDE5. And then your drug ligands is always a hot topic. So make sure you know your drug ligands. So these are the medications that are helpful for neuropathic pain, while your PDE5 inhibitors are basically your medications that will help out with sexual dysfunction. Like patient is on SSRI and they're put on a PDE5. So that's your rapid absorption. Okay. Next, the right option might have the same words as the test question. It can be the same word or synonymous to the word. So that's your strategy number 4. So make sure guys know your strategy number 4, synonymous. So what are synonymous, guys? So they will tell you keywords that are important. Like for example, which of the following is your highest priority for a patient that relapsed on alcohol? So you will choose an answer that talks about an alcohol intervention. Okay. So if there's a question about the timing of the onset of the disorder, like when do you usually see mania for your patient? So if it's more than 45 years old, it may be a medical problems, okay, and not a full-blown mania. You need to know the onset. If it's schizophrenia question, you need to know the time frame that we know that men could have it earlier than female. So 18 to 25, while female could get it later, 25 to 35. And then if it is a ADHD question, you need to know the onset, right? Before age 12, there should be like a valid assessment or valid testing for us to consider this as ADHD. But if they don't have a clear history, then we do further testing for your patient. Okay, so remember there could be synonymous, they could be same word, and you could apply that as a strategy. Next, client focus. I mentioned to you a while ago about a patient that got sodomized. Never ever leave them alone. If it's a victim of abuse, if it's a victim of like a homicidal or suicidal threat, or you need to make sure to always do your um do your action as a psych NP to at least promote safety and at least reporting it to the CPS, give them provide them with a safe environment, especially if they get raped and now they're in the hospital. Don't do any invasive procedure. Specifically, they will ask you, are you going to do an invasive procedure, or are you going to defer physical exam for the patient? Of course you're going to defer them, especially if they're in crisis. So talk about safety, talk about privacy, unless it's a suicidal question. Unless they tell you my boyfriend will commit suicide after his shift at McDonald's, you have the duty to warn. Okay, duty to warn. Yeah, that's your Tarasoft law. They always love to ask you about Tarasoft law, which is the duty to warn. Okay. Next, when several answer choices are remarkably similar, they're usually the wrong answer. So what do you mean by that? When there are two similar options, let's say here, letter A says there's an elevation of the blood pressure. And then the letter B option says there is an increased blood pressure. So we know if there's any synonymous option there, they're not usually the best answer. You have to identify them as distractors. Remember the ruling of 2-2-1. 2 distractors, 2 potential answers, and 1 best answer. If you practice the 2-2-1 method in your exam, you'll go a long way. You'll be like smooth and sailing with your questions. So remember, these are the top 6 strategies that I want you guys to remember. Once again, read all the answer choices thoroughly, okay? I want you guys to make sure to remember that. Any question with this top 6 that I'm telling you? Linda Chow, anything that is not clear? Karina, Marva, any question? You guys can utilize your chat box so that if you're shy to talk.
Number 5,
Okay.
what is the Taurus of?
Soft law, that's the
Yeah.
duty to warn, okay? So if anyone will tell you that they are trying to kill someone or hurt someone, then we are obligated to mandate a reporter for that. Okay? So Taurus law, remember that is duty to warn. Okay? So you need to make sure you know that for your domain number 5. Okay. Thank you. Everybody here? Okay. Once again, if you haven't done so, introduce yourself into the chat box so we create a community later on. And once again, top 1 to 6, and remember the 2-2-1 ruling, okay? 2-2-1 ruling. Two distractors, 2 potential answers, and 1 best answer. All right. Thank you, Patricia. So that's top 6. Now we move on. We want to make this interactive and personalized, guys. Okay, so I just want you guys to make sure use the chat box to interact with each other and also ask questions. Next, safety is important for the patient or others is usually the right answer. So what do you mean by this, guys? I overly emphasize, don't leave the patient alone. Don't put them on restraints and leave them alone. Don't don't go to a patient in a close proximity if they're punching the wall and they're about to hit you. You have to give something for them before you reach or before you talk to them. So if you did already the non-pharmacological approach, like I talked to you, but you're still assaultive, you're punching the wall, you're hitting the wall and kicking the wall and cursing at you, like saying F you nurse practitioner, don't come closer to them. You need to make sure initiate your next step, which is to go with medication. Because even if you give them PO medication, they can spit it at you. So that's not a good intervention. If they're already in crisis, IM Geodon or IM Haldol will be good. Remember, your medication could at least calm the patient's aggression and also for the patient to regain control. So once again, if you did the non-pharmacological approach, your next step of approach is medication. But if you did not do your non-pharmacological approach, like distracting the patient, putting them alone in the room, and then that's wherein you pay attention because the ANCC is big on interventions that are cost effective or non-pharmacological. But if the patient is already in crisis, then you always need to choose medication. Most common hot topic is IM Geodon or IM Haldol. They can cause QT prolongation. So remember, if they have QT interval or prolonged QT interval, the heart is working harder. They could be prone for cardiac dysrhythmias. So that's why we require them to be on annual EKG, and that's very important. Okay. Next, culture is important. Remember, we talk about Native Americans. We talk about Asian being prone for Steven Johnson syndrome. We also talk about Hispanic, which wherein they believe with a lot of like ritual rites, Maldio. What else? Someone died on them. They feel somatic symptoms like stomach pain that is not relieving. Then that's something that is more cultural. You need to always validate, okay, and acknowledge them. Anything with validation is important, okay? That's your keyword. Encouragement, validation, supporting your patient. That's an assertive inquiry and appreciative inquiry, which you need to remember, okay? Once again, culture is big in all nursing care. You can't just touch the head of the patient if they tell you this head is holy. If I'm If I'm telling you I need a medical interpreter, don't use my family member, but use a professional one. Okay. So you see it on the bedside sometimes they could use the family member, which is not right. Okay. So remember, always ideal and critical thinking is important. So what do you mean by critical thinking? You are given a question and a scenario that focuses on what will you do next as a psych NP. If they're telling you, I want to stop my medication, these medications are all crap. I don't want to take this medication, but I have bipolar and schizophrenia. So you need to persuade me and you need to tell me what are the risks and benefits of completely stopping the medication versus continuing the medication. So once again, when we say critical thinking, it is acting on your best behalf of, and also number two, acting on the best behalf of the patient, and number two, it need to be evidence-based and scientifically proven. So you can't just give a medication without a rational or without a sound reasoning. So on your exam, it's really, really important to focus on that aspect. Remember that, okay? Hot topic. So critical thinking means if they're allergic to a certain medication, you don't give it. If they have a side effect, like for example, Trazadone, they have priapism, then that's something that you need to decide to stop the medication because it causes them painful erection of their penis. So remember that. Trazodone, priapism, I remember that on my board. Trazobone. So if you have trazodone and they are trazoboning means they have priapism. That's for males. But female also could get priapism. You call that clitoral priapism. So if they tell you that they have clitoral priapism, then that's something that we need to act as psych NP to at least re-examine if the dose is too high or not enough and stop the medication. Switch them to a different antidepressant. Okay. As we all know, trazodone is given for sleep, given for depression, but also has a risk for you to develop priapism. Okay. Remember that critical thinking will go a long way with your exam. So once again, remember safety, remember culture, and remember critical thinking. Okay. And those are things that you can apply when we're doing practice questions later on. Next, let's do this question. I will call in Amanda McCormack. If you can unmute yourself. Are you here, Amanda? If not, I'll call in Harpreet. Harpreet, unmute yourself.
Hi.
Hi, I'm
Read the question.
sorry. I'm in this store and it's hard to hear. I'm sorry, what was the question?
Oh, can you read the question or you can read it later when you're in the safe environment?
Yeah, I'm gonna have to pass. I apologize.
Problem. Harpreet, unmute yourself.
Okay. Yeah, a patient being treated for schizophrenia with the olanzapine. Which of the following is the most common? First, like increased weight circumference, extrapyramidal side effect, increased lipids, or metabolic syndrome.
Okay.
So yeah, I mean metabolic syndrome, but it includes everything like increased BMI and insulin resistance. So I think metabolic syndrome.
Okay. Everybody agreed it's metabolic syndrome? Type in your answer into the chat box, please. All right. Letter D is correct. Metabolic syndrome. Okay. So what is our rationale for that? Karina, can you tell me about olanzapine in terms of metabolic syndrome?
Well, it causes weight gain.
Okay.
So I think like pretty much all of them can be right. So So D can pretty much covers it all.
Okay, remember that, okay? So when we say metabolic syndrome, guys, you need to check their blood sugar, you need to check their lipids, and you need to check their their LFT, their hemoglobin A1C for your exam, because we're focusing on monitoring, are they getting better or not with the certain medications. Okay, remember that. And what is the strategy for this? Umbrella questions, okay? Remember that. Umbrella is, if you look at letter A, and if you look at letter B and letter C, when we say umbrella, one answer covers both. So A and C are covered in your option letter D. What is umbrella again? One empowers or covers the rest. Remember that, okay? Hot topic. Everybody understand this? Now, Karina, your patient is smoker and is on olanzapine and is more psychotic. What will you do as a psych NP?
Mm,
Your patient is coming into you telling you, oh, I'm smoker, heavily smoker, and I'm seeing things and hearing things more than usual.
we can maybe decrease.
Okay.
Increase.
So I'm more psychotic and I'm
Or
doing
increase.
cigarette smoking.
Because nicotine is a inhibitor.
Okay. So make sure you remember that for the boards. Nicotine, guys, is inhibitor or inducer.
Reducer.
Okay, so remember nicotine, Karina, is an inducer. When we say
Oh,
inducer,
yeah.
it makes the medication less effective. So remember
So
that.
you increase it. You increase the olanzapine then.
Correct. Because if they're more psychotic, it means that the medication is not effective. Okay. Everybody understand that?
Would you repeat it, please?
So nicotine is an inducer. When we say inducer, that guys, it makes the medication less effective. So if I'm smoking and I'm on Cyprexa, it makes the medication less effective. Give me one moment. Now, how about if I rephrase the question, Karina? Your patient is smoker and now decided to quit smoking, and now they have a stable symptoms of schizophrenia, so they're not psychotic anymore.
So you decrease it.
Okay, so you can reduce the dose. So remember that, okay? Everybody got that correct? Questions? Class, any questions? No?
No, no questions.
No questions asked, okay. Okay, next, we're gonna go over the umbrella question once again. This is very important for your boards. So when we say umbrella again, one option is what again? Covers everything. So it covers everything. That is a big hot topic for your exam, okay? Remember that. Next, we're gonna go over your next strategies, which is interprofessional collaboration. So when we say interprofessional collaboration, we're venturing over towards what? Questions that are interprofessional collaborations focus on referral. So if a patient, guys, have a problem, hip fracture, What else? It's a dietary questions. It could be a question focusing on eating disorder and it's out of our scope of practice. Like you're not a nutritionist, you're not a dietitian, but they're very non-compliant with their medication, then that's something that we need to refer to dietitian in terms of their diet. So if they're non-compliant, they're eating more than usual, or they're starving themselves, they have anorexia, you need to involve the dietitian who is the expert. How about if this is a case of an obstructive sleep apnea? What will be your focus? So if I have sleep apnea, who can we refer the patient to?
E,
Letter A, sleep study doctor. Letter B, cardiologist. Letter C, respiratory therapist. Or letter D, occupational therapist.
sleep therapy.
Okay. Sleep doctor, okay? Anyone who is specializing on that one will be important. Next, if your patient has is on Celexa, of course, we need to make sure that they are referred also to cardiologists because Celexa can cause prolonged QT interval, okay? Or it can cause cardiac dysrhythmias. If you observe that the patient's reflex is still present at a certain age, like for example, you have the mother reported to you that they still have like fanning of their toes and they're beyond 2 years old with the child, of course, we always need to make an appropriate referral for the patient. So once again, stay on your lane, but you're not specialists. So any questions that revolves around collaboration, the diabetes is not well managed already, the hemoglobin A1C is higher, like 10, and your patient has symptoms of diabetic ketoacidosis and you saw them in the clinic, you need to make sure to arrange hospitalization because you don't have fluids, you don't have insulin, and then of course it's not within your scope of practice. Remember that, okay? So we did this umbrella question. The next one is best answer choice, okay? So what do you mean by best answer choice? Remember, answers that acknowledge the patient's feelings and make the patient heard is very important. Remember, anything with tell me more, anything with focusing on the patient's perspectives and validation of their feelings are all therapeutic. So you always need to make sure to remember that. Next, they need to be heard. You need to validate their culture, and they always need to involve in the patient's plan of care. Next, guys, lithium, okay? May I call in Joyce? Joyce, what are your nurse practitioner interventions for a patient that is undergoing lithium? What are your patient?
Hello.
Yes,
I was caught off guard.
no problem. Tell me
Can
about
you hear
lithium
me
first.
clearly?
So
Yeah.
remember,
So
in
lithium,
order for you to be successful with this exam, you need to know the content, the basic. Then after the basic, we break it down to more detailed, detailed exam questions. Okay. So let's talk about lithium.
correct. So lithium actually is a drug of choice for bipolar mania. I've already, however, one of the main considerations there is when a patient is on lithium, I highly emphasize that they have to have at least a lithium level drawn because the therapeutic index is very narrow. It's only 0.6 to 1.2. And also, I encourage them to have a comprehensive metabolic panel,
Okay.
especially the sodium level. Because the thing is, when you're on lithium, you tend to drink a lot. That's why we have to check the serum sodium level. Also, I had numerous experiences with patients on long-term lithium therapy where they ended up in ICU because they had renal failure. So the lithium level was, I believe that was 2.2. And what they did was they have to do an emergency dialysis on the patient.
Okay.
That's why. So I
So
think that's all that I can share, Doc.
thank you, Joy, and thank you, Jamie. So I put it in the chat box, guys. Let's make this interactive. I want to get to know you guys in terms of answering questions. So lithium, Very important, Jamie, Raymond, TSH, and why are we checking for the thyroid stimulating hormone, guys? Because lithium, it can cause hypothyroidism. We talked about that a while ago, right? Next, we also talk about kidney, because Jamie, that's another hot topic. Kidney is lithium is nephrotoxic. So make sure you guys check the kidney. If there is what positive 3 proteinuria, positive 2 proteinuria, then that's something have to do with the kidney. So you always need to make sure to remember that. Pregnancy is also important. And why are we checking for pregnancy, Jamie? Jamie, if you can unmute yourself, why are we checking for pregnancy?
Yes, because it can be fetal toxicity
Okay,
during pregnancy.
correct. They can cause a disorder called
Yeah,
Epstein
Estine, I'm not, yeah.
anomaly. Very good. And that's the reason why we don't give it in the first trimester. Remember that again, okay? Epstein anomaly. Great. Abiola, that's great. And also, we want them to be fully hydrated. So if they're going on a hiking, especially in summer, you go to Yosemite in California or you go to Mount Everest, make sure they have a lot of water, bottled water like this. So at least tell them bring extra canteen of water. So remember, lithium is important. Hydration is important. The more dehydrated your patient is, the more toxicity. The more lower the sodium is, the more toxicity for your patient. Remember that. And then, of course, you need to tell your patient that if they are not getting better with it, of course, the lithium can be increased and the levels can be checked. And if they have nausea, vomiting, diarrhea, or fine coarse hand tremors, then that could mean early signs of toxicity. Okay, so once again, know your normal levels and not with you during your exam, 0.6 to 1.2. If there's a discrepancy with the levels, we always need to hold the dose and recheck it. If it's toxicity, if it's subtherapeutic, it means it's below 0.6, then we can adjust the dose accordingly. You can make it twice a day, 3 times a day. But remember, lithium is a hot topic because it can cause hypothyroidism. So the signs of hypothyroidism, again, guys, they could have hypothermia, they're gaining weight, their heart rate is low, their blood pressure can be low, and then also they could have cold intolerance. So remember that, okay? It's the opposite of your hyperthyroidism. Everybody clear with this? So once again, you need to know that lithium has evidence of anti-suicidal effects. Remember that. Thank you for participating. Is there any recommendation while holding lithium because of possible toxicity? So you always need to at least hold the dose. If there are other mood stabilizer, could be used as an adjunct. And if the lithium remains to be elevated, then we don't give the dose. Okay, remember that. Next. It is also important to look at baseline labs for initiation of lithium to ensure safety and efficacy. So remember that if they have a narrow therapeutic index, you need to check the levels, check if they're pregnant, check their kidney function, check their weight, because they could gain so much weight. Another strategy is be wary of absolutes. Remember, anything with all, only, always, every, must, never, none, everything, and nothing are usually the most incorrect answers. So remember that for your boards. Any boards that you're taking, NCLEX, FNP exam, PsycNP exam, we always need to eradicate all, only, always, every, must, never, none, everything. Because basically they are usually wrong answers because they limit the answer choices. So they are generally wrong. Unless it says there that they're suicidal, then always stay with your client. But when they tell you always, everything, all, always, are this, then you're stereotyping. Everything, nothing, none, only. So those options kind of like stereotype and narrow the options. So they are called generalization. Keywords are usually incorrect in a multiple choice answer. Unless they're suicidal, then always stay with your client. But majority, they're usually wrong. Next, we talk about priority and initial action. Remember, airway, breathing, and circulation. We know that for your NCLEX is important, but for your PsycNP, if you're talking about airway, breathing, and circulation, anything that involves that your patient is developing Stevens-Johnson syndrome. We know that's an airway compromise. Their tongue will swell up. So if they have a Stevens-Johnson syndrome, that's an airway compromise, and that's our priority, airway. Anything that they're allergic to, pay attention because we don't give your patient medication that they're allergic to. Maslow's hierarchy of needs is important. You need to remember that safety is always asked and always be prioritized to your patient. If the patient is not eating, then also consult the dietitian because we know that it goes beyond our control, always involves someone that is expert for it. Dietitian or nutritionist is always important to be involved with. Water, hydration is important for lithium. Warmth, rest is important, specifically for patients that have undergone crisis or trauma, and security. Always make sure that you have enough people or enough staff on your unit to help your patient out. Next, nursing process is important. Any exam, guys, you always go back to the timeline of assessing the patient before intervening. So what do you mean by that? Are they suicidal? Are they homicidal? And before you decide to hospitalize them, did you do a questionnaire for them? Did you do like at least a non-pharmacological intervention before giving medications? So always assess before intervening. What are the keywords for assessment? This may mean identify. What else? This may mean assess. This may mean ascertain, determine. These are the keywords that I'm looking for when I'm testing. So anything with identify, assess, ascertain, and of course, pinpoint, those are your assessment. Okay? They could use it at different terms, but they mean the same thing. Next, collecting data before the problem towards a resolution. So before you stop the medication, check their lab works. Am I correct? Thyroid panel is for lithium. Serum creatinine is for your lithium. You know that. PUN is also for hydration, lithium. Pregnancy test is for your Depakote, for your lithium. Benzos, you need to check if they're pregnant because they can cause floppy baby syndrome and cleft palate. So remember Depakote, carbamazepine, spina bifida. So when they have spina bifida, then it can cause intracranial pressure for the baby. And once they're out, it could be problematic. If they're pregnant and they started Depakote, then there's a higher chance of myelomeningocele or your spina bifida occulta. And the next EKG for clients older than 50. As I have told you before, giving medications, I am Haldol, I am Geodon, or any medications that can cause T-wave inversion from the lithium, or anything that causes abnormality with the cardiac rhythms, you always need to order an EKG. So once again, stabilize your patient. If they're not stable and you're seeing them in outpatient, always call 911 or arrange transportation for them to be hospitalized. So once again, look for your keywords, assess before intervening, and before intervening, did you do your jurisprudence to do that? Okay, let's validate your learning. What again is the complication if I'm on Depakote and I'm pregnant? What again is the complication if I'm on lithium and Depakote or benzos? If you can type all those three. So what are the complications if I'm on benzo, Depakote, and lithium, and I'm pregnant? So you fail to choose, or you fail to order a lab for your patient. What are the most common complications for your patient that has that? Type in your answer into the chat box. So once again, benzo, what do they do? There could be FBS or CP. So remember, FBS equals benzo. And what is that? Flappy baby syndrome. So you see babies, once they're out, they're doing this. Flappy baby syndrome. And then if they have benzos, they can cause them to have CP, cleft palate. So that's why if they're on lorazepam, oxazepam, temazepam, Xanax, you need to make sure if they're pregnant or not, because it can cause cleft palate. Defecoat is spina bifida. Great job, Abiola. Put a star on that one, everyone, into the chat box. Spina bifida. Great. Na says benzo is cleft palate. Correct. Spina bifida for Defecoat. Correct. How about for lithium? I think everyone knows that about one. Thank you, Abiola. Everybody, guys, participate so you guys remember it. The more you participate in this session, the more successful you're going to be in your actual exam. So remember that. Great job, Abiola. She summarized it. Benzo is flappy baby syndrome. Cleft palate. Lithium is for Epstein anomaly. And then you have your Depakote, spina bifida. Great job. Everybody clear? Thumbs up if everyone's clear for this reason. So we proceed to the next slide. Everybody good? Once again, guys, later on, I'll give you guys a multiple choice battery exam for today's workshop. So you guys are able to answer your exam with smooth sailing. So remember hypothyroidism once again for your lithium. Okay, now we go with your task content outline. So this is very important, guys, in navigating your exam, okay? And if we go to the chat box, everyone, I will give you guys a breakdown of what you're gonna expect for your exam. And it's very important to know this task content outline. I'm just pulling out something. Give me one moment. So please save this in your file. You can take a screenshot also. The most common questions that they ask me since I've been coaching this exam is how many questions is which? So go to the chat box, guys. Most common questions that they ask. And I will call in Joyce. If you can read what is on the chat box, please. So what is the task content outline? Are you here, Joyce? So how many questions are test takers expected to answer on each section of your PMHNP question? You're muted, Joyce. Are you here, Joyce?
I'm here. Hello.
So,
Hello.
yeah, on the chat box, guys, I put in the breakdown for your test content outline.
Mhm.
So what are how many questions is scientific foundations, Joyce, on the chat box?
Scientific foundation is 30 questions. It's going to be 20%.
Correct. So what is scientific foundation, Joyce? These are your 3 Ps, patho, forms, physical assessment, but including your psychopharmacology. So remember that, okay? You have your neurology to psych and genomics. And how many questions again, guys? 30%. Once again, don't forget, 30% of your exam will come out with your scientific foundations, okay? So let's talk about half-life for the medication. Okay. May I call in Jacqueline? Jacqueline Samoa? Meet yourself. Which one has shorter half-life in terms of the SSRIs, and which one has the longest half-life in terms of your SSRIs?
Doc, I'm sorry I passed it on my work, but it will be let me see.
And everybody could type in your answers into the chat box too, okay? So Zoloft or sertraline has the shortest half-life. Remember that? Hot topic. Half-life. And then your longest half-life will be your Prozac, okay? Remember that Prozac is longer half-life. Fluoxetine, remember that. So if I'm a patient that is non-compliant, I'm going on a cruise all the time, going on a jet plane all the time, it's the holidays, then I will take my Prozac, because Prozac lasts longer, 3 days, versus your Zoloft or sertraline, which could only last less than 24 hours. So remember that, okay? Longest half-life versus shortest half-life, okay? Next, remember we talk about SSRIs. What are the S of the SSRIs, guys? I want you guys to remember that most questions are focused on side effects. Most questions are talking about the most basic ones. S is stomach upset for SSRIs. Another one is S, salt is decreased for SSRIs. And then what again? Sodium level is decreased or salt. And then serotonin syndrome. What is the drug of choice? Type in into the chat box. What is our drug of choice for serotonin syndrome? Need to make sure you remember that. And then what is your drug of choice for your patient that is undergoing NMS? So remember NMS. So all the S, sexual dysfunction, stomach upset, serotonin syndrome, or hot topic. Salt is decreased, and of course, sex is decreased. Serotonin syndrome is higher with the SSRIs, and we know about sodium level, which is 135 to 145. So Joyce, what is the medication of choice for your serotonin syndrome?
1 second here.
So remember your NMS is Danbro, and Joyce, remember your SS is CP. Serotonin syndrome is CP. So when we have serotonin syndrome, letter C, make sure you guys know this, cyproheptadine. Or your periactin, they're the same, okay? And what is Danbro? Anyone who knows Danbro? What is Danbro? Type into the chat box. You call that dantrolene. Very good. And then bromocriptine. So make sure you know Danbro. Or my brother is done. My brother is done and he has NMS. Then we give the bromocriptine and dantrolene. Dantrolene, guys, is a drug of choice for what? Muscular rigidity. And then your bromocriptine is used for vital signs instability. So make sure you know the difference, which one we're going to give for vital signs instability, which one we're going to give for your muscular rigidity. Okay. Next, your question, your advanced practice skills. Karina, are you here? How many questions will you be asked for advanced practice skills?
I 38 questions, 25%.
Correct. So it's a big chunk of your exam, okay? So make sure you guys know your advanced practice skills, okay? Tell me about your advanced practice skills again. It covers your assessment, your health promotion, disease prevention, psych emergencies, and screening tools. And then also very important to know your numbers, okay? Know your numbers, guys. So let's do a question on particular questions. Okay. And then also you have your disease prevention and psych emergencies. May I call in Naya? Hi, Naya. Great to see you again.
Okay, hi.
Hey, you know, Gil passed his exam recently.
Yes, I was so happy.
Yes.
Mm,
He's supposed to be here, but he has work, I think. So if you can go to the chat box and read the question, please.
okay. 1 minute.
Chat box.
Yeah.
In the chat box.
Yeah, I'm putting on my glasses.
Everyone, go to the chat box.
Okay.
Everyone, please.
Okay. So a 48, is that the question? A 48, 48, okay, 48-year-old Caucasian male patient present for his therapy session. He is sad about losing his wife recently to COVID-19. He reports feeling thoughts of hurting himself. He has a past history of overdosing on propranolol, I'm sorry, several years ago. Which of the following places him at high risk for suicide? Previous suicide attempt, age, gender, and marital status. Well, he's a male, he's Caucasian, but the age, 48 is not that bad. If it were to be 64, I think previous suicide attempt, because the age and the gender, they have similarities. So I'm going to take D out. I would take C and B out. Reason why is that the age and the gender, they are the same and I'll take the previous suicide attempt.
Okay. Remember, I'm seeing a lot of letter A. Naya, what is your answer?
A.
Okay. Are you the next Psych NP board certified? Yes or yes?
Yes, 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 yes.
Very good. I love it. So remember, guys, if there's any previous history of suicide, it places the patient at highest risk for suicide. You are not comparing a patient with another patient. Remember that. Therefore, you are not to count the risk factor for this question. Okay? Everybody got it correct? So once again, that's your advanced practice skills. You could be asked about health promotion, disease prevention, psych emergencies, and screening tools. And very good, Abiola. Anyone who have repeated suicide or suicidal attempt will commit suicide again. So make sure you guys remember that. Once again, very important. Great job, Naya. Next, may I call in Miss Fiji? Are you here, Miss Fiji? Fiji Simons, are you here?
Yes, I'm here.
Hi, if you want to read the question, where are you from again, Fiji?
Oregon.
Oregon, great. How's the weather there today?
It's a little sunny, but it's like 37 degrees outside.
Great.
Some snow on the ground, light snow.
Oh, wow. California was spoiled. We have no snow. Just
I know. I just moved here. I'm originally from California as well. I just moved here for work.
Nice. All right, go to the chat box and we're going to talk about diagnosis and treatment with this question.
Okay. You want me to read it out loud as well, or how do we do this?
You want to read it out loud with the options.
Okay. A 72-year-old female is brought in by her husband with increasing forgetfulness, decreased activity, and decreased appetite for 2 months. She has a history of hypertension and is being treated with lisinopril, The exam is normal and the mini mental exam provided a score of 24, but she declines to answer some questions and needs to be urged to participate in the assessment. What is the most likely diagnosis? A, Alzheimer's disease, B, vascular dementia, C, depression, D, medication toxicity.
Okay. Everybody, please type in your answer into the chat box. You'll be asked a particular scenario of a patient like this. So remember, your DSM-5 diagnosis is on your category number 3. It says here on the slide, guys, diagnosis and treatment, DSM-5, treatments both pharmacological and non-pharmacological, differentials, lab studies, evidence-based practice, drug-to-drug interaction are also important. Okay. So type in your answer into the chat box. So look at the symptoms, guys. Remember?
Mm.
Okay. Some of you answered letter B and some of you answered letter C. This is the first time that the class is divided into 2 answers. May I call in Esther Chung? Can you tell me why did you choose letter C?
I think
because of decreased appetite and decreased activity, maybe motivation, and forgetfulness, difficulty concentrating.
Okay. And what is the onset, Esther? What is the onset of the disorder? Is this acute?
For
Is
2 months.
Chronic?
So at least more than 2 weeks.
Okay.
2 months.
2 months. Remember, if it's 2 to 3 months, is it chronic or acute, guys?
Acute.
So if it's 2 to 3 months, it is considered acute in onset. Remember, be careful, guys. What did I tell you? Today's workshop. Make sure, guys, pay attention to the timeline. Am I correct? And when we see timeline, it's highly important that you guys pay attention that if this is maybe what a case of a what? So once again, is this acute or is this chronic?
Let me see.
Acute.
It's acute.
Okay. Final answer?
Still think it's good.
Type in your answers into the chat box. You are the next PsycNP board certified. Let's do this, everyone. So once again, what is the answer? Answer is letter C. Once again, why answer letter C? Remember, if it's acute in onset, it's not Alzheimer's or dementia. Remember that, okay? So what are the hallmarks of your vascular dementia, guys? What do we see for vascular dementia? We have carotid bruit. Remember that? And then also for patients that have pseudodementia. Remember, it's not a form of dementia, but most likely falling into the category of your depression. Okay? So Esther, are you correct with your answer? Yes or yes?
Yes.
Everybody needs to understand that. Great job. Everybody clear with this question? Do I need to explain it further? So what dementia, guys, have visual hallucination? What
Yes.
dementia has visual hallucination? How do you call that dementia with visual hallucination? That's
Is that
your
Lewy bodies?
Lewy body. Great job, Michael. Hot topic. Next, Michael Longwell from Ohio. Am I correct? You want to go to the chat box and read the question, please?
Sure. Which of the following patients is at a higher risk of suicide? A 30-year-old married African-American female with a previous suicide attempt. B, a 35-year-old single Asian male with previous suicide attempt. C, a 38-year-old single African-American male who is a manager of a bank. D, a 68-year-old single Caucasian male with depression.
Everybody type in your answers into the chat box. You got this, everyone? So is it Apple, Alpha, Beta, Charlie, or Delta? Okay, but Michael, can you tell me the rationale why you're choosing that specific answer?
The rationale I would look for, I think we discussed before, the greatest predictor of future suicide attempt is previous suicide attempt.
Okay.
I'm sorry, go ahead.
And you answered letter?
Letter A.
Okay. Everybody agreed? So remember, now we're comparing, right? In questions like this, when you're comparing, you need to look for the risk factors.
I chose D because of the risk factors of the lady. She's old and maybe she might be staying by herself and she's going through depression.
Okay.
You know, some older people too, they don't go for counseling because of what's the name? They don't have that education of the resources they have. So that made me will go with D.
Okay.
For my answer.
Thank you, Jacqueline. How about, let me call in Viola. Viola, you answered letter D. Why did you answer letter D?
Yeah, because a single 68 is a male Caucasian with depression. So those are risk factor too.
Correct. So the higher the number of your risk factors, the more that you're gonna commit suicide. Am I correct, guys?
Yes.
And the higher, count the number of risk factors so you
Yeah.
know which risk factors is at risk for suicide.
The age, 1. The single, 2.
Raymond says
Caucasian, 3.
Age,
Male,
male,
4. And depression, 5 factors.
5.
5 factors.
final answer, everyone.
D.
D. D for dog.
Okay, remember that. D for dog.
D for dog.
Delta. Remember that. So that's part of your questioning. Make sure, guys, you practice your critical thinking. Okay. And that's
Question.
exercise when you're testing for the board exam. It's
Question,
not
sir.
about what you know, but it's all about identifying keywords, right?
Questions. Say another research we found about male. I think males have more depression than females. I read an article somewhere. So that can also be a.
Okay. So male or female? Remember, the male are more what? Able to commit suicide.
Yes, than
Male are
females.
more
Yes.
prone.
Females are
Yes.
attempts, right? Okay, very good. So it's an eye opener, guys, right? For this question. Next, may I call in Singy Macaulay? I'm a Singy. Where are you from?
Oh, I'm from Georgia, Lawrenceville, Georgia.
Yes, how's the weather there?
Oh, it's beautiful this afternoon. Sunny.
Great. Never been to Georgia. Probably if there's a conference, if we're doing an in-person review later on, I'll visit that state. Okay, Georgia. Miss Georgia, I'm calling you Miss Georgia, okay? Can you go to the question in the chat box, please? This is part of your domain number 2. You want to read it? Your class, please.
All right. You have a new patient and informed you that they have been taking Lexapro 20 milligrams for 3 months for GAD, generalized anxiety disorder. Upon screening, the score on the GAD-7 is 2. What adjustment will you do on the dose of their Lexapro? A, increase the dose. B, decrease the dose. And C, make no changes. I think I'll go with C because the GAD score is 2. That means the anxiety is well controlled. So I'll just leave it the way it is. I'll leave it. I'll not make any changes to the dosage.
Okay. Final answer?
The final answer is C. Make no changes.
Okay. Everybody type in your answer into the chat box. Okay. What is your rationale again? What is the number? Are they stable on the dose of the Lexapro?
Yes.
Yes. So the lower the number, the better they are. Thank you, Michelle Patty. Thank you, Miss Georgia. Great job, everyone. The answer is letter C. If they're stable on the dose of Lexapro, remember, if the sink is not broken, are you going to fix the sink? Yes or no?
No. No.
Great job. Next, may I call in Michelle Patty? Hi, Michelle. Are you good with the scales, Michelle? Michelle may not be able to talk. May I call in Damber Temsina? Did I pronounce your name right? Miss Temsina? Are you here? Or Marge Dawson, if you're here. Marge?
I can see.
Okay. How are you? Where are you from?
I'm from Florida.
Okay, great. The weather is nice there for sure.
Yes.
Okay, Sunshine State of Florida. Marge, if you can go to the chat box and read the question, please.
Okay. I can see it. Have the last question, but I'll see the new one.
I just type it there. Should be there. Able to see it. Talking about Hamilton D.
No.
Can you see it?
No.
Yeah. Okay. We'll call you later. We'll call in Eddie. Hi, Eddie. You can unmute yourself. Are you able to read the question into the chat box? Eddie, unmute yourself. We cannot hear you. We'll go back to you, Eddie. Anyone? Volunteer, please. Read the question.
I'll read.
Okay.
Okay, my name is Martin. I'm from Texas. So
Great.
it says, 4 weeks, this patient comes in for follow-up, and their HAM-D score becomes 16. What adjustment would you do in their antidepressant dose? X, would you A, increase the dose, B, decrease the dose, C, make no changes? I'll go with decrease the dose.
Okay. Why
Because of the first,
decrease the dose?
because of the first question we did, right? It was less than 7. Oh, maybe I didn't understand the question.
So Hamdi, what is the score? 22.
Oh, okay.
Okay. So what are you going to do in a
No, make no changes.
So the score is improved, am I correct?
Yeah.
22 and it becomes 16. So if the score is increased, then you might want to increase the dose because it was ineffective. But for this one, remember what is opposition? Increase or decrease, guys? If there's
Increase.
improvement, the score is improved, and then the answer should be leave the dose alone. Am I correct? So everybody understand that? Once again, the score is improved. We leave the dose where the dose is at. Very good. Joy also said the rational. Thank you. Length of time of antidepressants has to be considered. Patient is improving. Great job. Okay. Next, Karina, unmute yourself.
Hello.
Right. You can go to the chat box too and read the question.
Let's see. Okay. Before implementing EDP changes, an adult PMHNP's initial action is to brainstorm with stakeholders and draft a detailed problem list, compare data with internal and external benchmarks, and coordinate ongoing education. C, facilitate a collaborative multidisciplinary group to synthesize evidence and compare key themes. Or D, identify potential barriers and facilitators that reflect patients' values and expectations.
So remember, what is the first step of nursing process, Karina?
To assess.
Always start with assessment. So which one is assessment here?
D.
Okay.
For dog.
Everybody type in your answer into the chat box. Remember, do your test taking strategy. Always start first with assessment. Am I correct? So look at your keywords: brainstorm, compare, facilitate, and identify. So what is the answer, guys? Always start with assessment. Always start with initial action to address, to identify first. Because respect first before we build a therapeutic rapport. Am I correct? And when it comes to culture, respect is also important. So always start with the nursing process. Everybody understand that? Great job, Granisha. Great job, Patty, Jacqueline, Jamie, Damber, Naya, Viola, Fiji. Great job, Joy. Great. You are gonna nail this exam. Next, Miss Young, Granisha, unmute yourself. Hi, Granisha, are you here, Miss Young?
Yes, hello.
Yes. Where are you from?
This is Michelle. Can you hear me?
Yes. Where are you from?
I'm from Boston, Massachusetts.
Oh, great. How's the day? Cold?
It's cold. It's very cold this morning.
Oh, God. You're enjoying a holiday like New York. New York's very Christmassy.
I am.
Okay, great. Oh, Patrina Brown is in Massachusetts. Make sure you do that. So if you can go to the chat box, please, and you read the question. Denver, almost there. I'm
Okay.
going to close it.
1 second, I have to go up and read it. Okay. In counseling a 23 years old male with Hispanic mother who brought a 4 years old son to the clinic for mild day ojo with symptom of fitful sleep, diarrhea, vomiting, and fever. The PMH and sleep disorder, and fever. The PMHNP identify what step the mother has already tried in caring for the child's symptom. Explain that the symptoms are most likely caused by a viral infection. I'm going to scroll down. Educate about importance of maintaining fluid and electrolyte balance. Respect the mother's understanding of the child's illness. I will go for D because it's a culture thing. We just have to validate their culture and with support therapy, I will say that. Is it that?
Okay, remember that. Respect is always important. Remember, respect begets respect. If you do unto others as you want others do unto you, that's our golden rule. And that's very important. Remember that. When you're answering a cultural question with a cultural answer, always respect comes first before you build a therapeutic rapport. So remember that, okay? Build a therapeutic rapport, it's always respect. Great job, Miss Boston.
Thank you.
Next, may I call in another Miss Boston, Patrina Brown? Probably you guys can connect together and be a study buddy. Patrina Brown? Unmute yourself, please, and go to the chat box.
Can you hear me? I have a little one here talking.
You're from Massachusetts, Boston too?
Yeah, I live here. I'm from South Carolina, but I moved here about 3 years ago.
Oh, wow. Okay.
I was in California prior to moving here, so.
A lot of Californians moving out. Okay. Next, if you want to read the question, please, and the answer, please.
Okay, let's see. The PMHNP is asked to consult with a local inpatient psychiatric facility to provide nursing staff development. After meeting with the administrator to identify the nature of the problem requiring a consultation, the PMHNP next step is to, let's see, A, create an interdisciplinary teaching team. B, develop outcome measures. C, market the education plan. Or D, utilize a survey to assess the educational needs of the staff. So I think I will say assessment. This type of question is asking, looking for assessment.
Okay.
So yeah, I'll have to go with create, develop, market, utilize, survey. Yeah, I'll have to go with D.
Final answer. Hi. You have a little one.
Yes.
How old?
She is 21 months, and then I have a 5-month-old who's asleep, so I'm pretty busy.
Oh, yeah. I will be busy next year, guys. We're expecting twins.
Oh, nice.
My wife is pregnant. We're 5 months expecting, so 4 more months.
Wow.
Yeah.
That's awesome.
Great. Okay, so the answer is, remember, always assess before intervening. And you guys nailed it really well, okay? So once again, that's your domain number 5, which could be ethical and legal principles with sort of like research question. Great job. So once again, make sure guys know your numbers, okay? When you're testing, we know that domain number 4 and 5 are the ones that we don't pay attention to. But domain 4, you will have 22 questions, 15%, and 23 questions on legal and ethical principles. So remember, the breakdown is 175, and you need 150 questions. I'll break it down here. So if you have 175 questions until this year, 150 once again are scored and 25 are pilot questions. And now next year, which were they gonna start, they will give you 105 questions. So you need at least 105 questions to pass with 150 questions, which is 350 points. Okay. So remember that. So once again, for your exam, lithium doesn't change, so don't panic. Even if they change it or lower it to 150 next year or retain it to 175, it's just a matter of getting the 350 points. Okay. So no scientific foundation, 30 questions, 20%. Advanced practice skills is 38 questions, which is 25%. Diagnosis and treatment, 37 questions. Psychotherapy and your 22 questions to 15%, and then ethical questions is 23%.
I'm sorry. What's the change again for next year? You say next year,
From 175, it's gonna be 150. Okay.
150. So you still need to answer 105.
Yes, 105 to pass. Okay.
Is it better, right?
Yes, because lithium doesn't change. Steven Johnson doesn't change. Serotonin syndrome doesn't change, right? So all the content areas are the same. It's just they lowered the number of items. Okay. Which is, I think for me, is a win-win. Why they're lowering it? Because the AANP is coming out with an exam too, which is 150. So they're trying to match both exam. So AANP is 150 and then ANCC is 150. Okay. So if you pass AANP, they will give you PMHNPC. That's gonna be your credential. But if you pass ANCC, you will get PMHNP BC. Okay. So if you pass both, you will have PMHNC, PMHNP, CBC. You're like a complete blood cell count, huh? Okay. So I myself, I want to challenge myself. I'm gonna be taking the ANP next year. So but you need only one to pass. Okay, you only need one to practice. You don't need
When
to
is it gonna start exactly? In January?
spring of 2024. Okay.
Okay.
What is spring, guys? Do you know what's? I think winter of January, February. So spring will be March, April. Is that correct?
Yeah. Okay.
At that time. Okay. So make sure you guys know your different categories. Any question with this one? So you have domain 1, domain 2, domain 3, domain 4, and domain 5. Any questions with this? No? Okay. So remember, the ANCC is also encouraging you guys to do 175, do more practice questions. You only need 70% to pass this board. Okay, answer correctly 105 out of 150 questions is the goal. Okay, and out of 150 questions, 25 are pre-test questions. Once again, pre-test questions are non-scored. Next, be confident. So what do we mean by being confident, guys? You are in the process of completing your graduate program or you are soon going to graduate. Make sure you guys know your content areas, which we were emphasizing a while ago with the 5 domains. Number 2, initiate your examination. Okay. So remember, there is 5 domains that you need to remember. In our website, if you go to www.passnp.com, we have question banks similar to what we did today. And we also have practice questions there that you guys can utilize. And we also have a predictor exam and we give you the rationale. Why not A? Why not B? Why not C? Because that takes a process. So the more you do your practice questions, the better you're going to be. Next, create a study plan. And this is what I can tell you, very important. When we say study plan, guys, at least 6 weeks of consistent daily preparation or attending a 2-week crash course or attending our crash course on a monthly basis will be your best guide. For those who have attended last week, you guys have the capability to at least ask questions, know your domains, and also ANCC suggesting that you need to prepare at least 6 months in advance. So if you are in the program right now, or if you're just finishing your clinical hours, we usually recommend you guys to at least study for 6 months consistently. Okay. Modify according to your individual preference. I know most of us have life work studies, and that's why we make simplification easy. We have on-demand review class in our website, QBanks, at your own time, and also one-on-one. Okay, and plan in writing your own credentials. Remember that, and also take breaks and keep the motivation so high. So one thing that we always emphasize in our review program here is we always say the yes, yes, yes mantra. So if I always ask, are you the next PsycNP board certified? You need to remember that. Yes, yes, yes. So once again, study now. Very important to create a study plan. If you're weak with domain 1, you're weak with domain 2 or 3, then you always need to make sure to emphasize on those 5 domains. And I told you the breakdown of the questions. Next, you could also look for study resources. There are flashcards, videos. I may start to do a podcast later on. So if I ever do a podcast, make sure you guys subscribe to it. I'll talk about test anxiety there. I talk about multiple choice question and how to combat your exam. And then remember, you cannot know everything. And this is what I always tell my students. You can't know everything, and that's okay. Always concentrate on the content you miss while attempting practice test question. So on our website, we have Q banks from domain 1 to 5 and another predictor exam that you guys can go into to know what you're good at and what you're not. And then virtual study room are important, and that's why we're doing this. I will offer more sessions for you guys, especially those that are not testing in a month or so. Please go to our website, subscribe, so you can see when my next class gonna be on the 5 domains. Next, we talk about test taking strategies. Remember this, stay mindful of the crucial terms. First, best, priority, assess, and intervene are really important. And then also limit your options to 2 potentially answers. So once again, limit your options to 2 potential answers, and that's very important. And pay close attention to important factors, age, gender, diagnosis for your patient. And then also the symptoms. So there's a difference between 1 month, 2 months, 3 months, 6 months in terms of the diagnosis. It may mean that they have adjustment disorder. Adjustment disorder is at least 3 months. Acute stress disorder is at least 1 month or less than 30 days. PTSD could be 6 months to 1 year. Dysthymic disorder or persistent depressive disorder is at least 2 years. So remember, 2 blue weeks is major depressive disorder. Okay, so you need to know the timeline because I'm not with you during the exam. They're gonna ask you, is this an adjustment disorder? Is this a PTSD? Is this a GAD? So you need to pay attention to those key terminologies. Okay. Next, review the question prior to answering the question. So what do we mean by that? Once you've chosen an answer, you can still change it, and but make sure to avoid changing your answers repeatedly. There's a lot of studies that your first answer is usually the correct one. So pay attention to that. Next, it is perfectly acceptable to begin by addressing the questions you are familiar with before returning to tackle the most challenging questions later on. And that's what I did too. All the ones that I know, I hit them. And then all the ones that I don't know, I could flag them or leave them unanswered. If they're unanswered, they're not going to change their shade. So you will be presented with boxes of 175 questions. Once they change their color, it means you have answered them. If all the 175 questions on the left side of your screen are unanswered, then they're not going to change in color. So once again, do not leave any question that is left unanswered before submitting your exam, because it will be detrimental if you leave one questions. That one question you may have passed. Okay, so before students coming into our boot camp every month, they come from another review. They scored 348, 347. And I told them that one question that you didn't change your answer, or that one question that you didn't overthink may have make it. Okay, so remember, overthinking, not answering all of the questions is a big no-no. Don't stay on one question for a long hours, okay, or a long time. So the minimum is 1 minute per question. The maximum is 2 minutes. So once again, don't spend 10 minutes in one question. You're never going to be finished with the exam. So make sure you guys have a time frame for that. Next, culture is important. Remember, in the aspect of being Hispanic, the aspect of being Asian, that's important. High quality of care and conflict management is important. So when we say conflict management, it's how you manage your RNs, your medical assistants, your staff, or your co-NPs, and that's very important. And then identify the fundamental action. So you need to assess before intervening and align your answers with assessment. Next, a lot of critical thinking, and I could not further emphasize that. And while prioritizing the safety of the patient, always go back with your ABC. And what do you mean by ABC, guys? If I'm allergic, I'm alcoholic, You need to hospitalize me. I'm hypokalemic. You need to hospitalize me. I'm what? I'm suicidal. You need to hospitalize me. I'm homicidal. You need to involve the police. Okay, remember that. Call the police if I'm going to commit suicide. If I'm going to kill someone, you need to make sure to report it. Okay, Taras of law. Next, we need to make sure we also cover your tools by Prometric. Remember, you guys will do the Prometric, and that's very important. Prometric has a website. Guys can go there to identify what you can bring and what you cannot bring. You have to be early, 30 minutes prior to your exam. So if your exam is 1 o'clock, you should be there around 12:30 or 12 o'clock so that you can get familiarized with the parking. Okay. Next, interprofessional collaboration is also important and needs to be emphasized, and we mentioned that a while ago. And delegation isn't always the best solution. So if you delegate something, you still own the responsibility. So you can't delegate to your MA to call the patient when they have a question about the medication. You always need to make sure that you're there for the patient. Okay. Avoid inaction. You are constantly engaged in some form of action for your patient. And if you encounter an option that you are unfamiliar with, refrain from selecting it. If you think that, oh, this may not be the correct answer, don't choose it. Avoid postponing treatment. Joyce, if your patient is already experiencing Steven Johnson syndrome, stop the medication. Serotonin syndrome, stop the medication. NMS, discontinue the offending agent. That's how they word it. Discontinue the offending agent. And then we need to stop the medication. Next, you can proceed with the certification question assuming unlimited staffing. So what do we mean by that, guys? Don't think that you will be short staffed. In your exam, guys, there's always unlimited staffing, and that's important. So when we say unlimited staffing, don't say you don't have help, because you always have help. Okay? Remember that. Next, when prioritizing, make sure do the unstable ones. When we say unstable, they are the ones that is hypokalemic. They have a low BMI. They have suicidal thoughts, and that's important. And then also restraints is always the last option in your exam. Okay, don't restrain dementia and elderly patients. That's not being ethical. Okay, and always follow the guidelines. Next, always, if the question includes severe, acute, these are important terms that we need to pay attention to. When possible, rephrase the question and put the question into your own words. If you possess an initial intuitive feeling, trust and act upon it. And make sure if there's an inquiry behind it, make sure you read the question carefully. What are the key terms? What do they stand out? Also, what data is pertinent? Are they Hispanic? Are they African American? Are they Native American? And make sure what will be your best response if you're given that question. So once again, read each question carefully. And then the day prior to your exam, make sure you drink a lot of fluids, make sure you're hydrated, and make sure also you eat foods that are high protein and not high carbohydrates, okay? Because high carbohydrates will put you to sleep, like peanut butter. Okay, let's do a practice question, guys. I know we're kind of like overtime. It's almost 11 o'clock. It's all 11 o'clock. I just want to show you guys some practice questions that we can offer you in our company, in our review. So once again, if you like what you're hearing and you like the review, please go to our website and then make sure to subscribe to our Facebook, LinkedIn, TikTok. We're all over social media. And we want to make sure you guys are successful. And please make sure to invite your classmates and friends. Next time I held this class again. So let's show you what our typical class looks like in a 2 days crash course and practice question. So if you are subscribed to our package, wherein you have QBank one-on-one, you also have like Video on demand. What is video on demand? You can pause the video. It's like I'm talking to you and you're watching me lecture, and then you can pause it when you're in the gym, or when you're in the park, or when you're driving into your work. You can listen to it too. Let's see here. Talk about this. Let's start a practice question so you guys know where to go to. Yes, and then I will post our website later on if you want to purchase our QBank. It's very cost effective later on. Let's see. How come it doesn't play? Press that in full screen. So for particular questions, this is how we usually set up our review. So you also get access to our review course without QBanks. We have almost 1,000 questions. So you only need 175 to pass this board, but we have 1,000 questions in our exam. So let's do this question. Naya, you want to read the question, please? Unmute yourself, Naya.
Okay. A psychiatric mental health nurse practitioner, you are assessing a married couple who has been experiencing high levels of caregiver stress due to caring for their adult son with schizophrenia. They are struggling to cope and have asked about possibility of respite care. What is the primary goal of respite care for this scenario? A, providing long-term care for the son in a specialized facility. So right there, I'm eliminating A. It's not the long-term. Teaching the couple new caregiving techniques. No. Offering temporary relief from the demands of caregiving. I'm choosing that one. Initiating involuntary commitment for the son's safety. So the reason why I'm choosing C is because respite care is like 2 weeks. It's a temporary relief thing. So right there, I'm choosing C.
Okay.
And that's my final answer.
Correct. So what is your primary goal for respite care? So this is your keyword. Remember I told you to always look for two potential answers and to remove two distractors. So remember, we could remove letter B, teaching a new couple new caregiving tactics, and then initiating involuntary commitment for the son's safety. That's not necessary. Providing long-term care. That's not respite care. But when we say respite care, this is your temporary relief. So that's how you should answer when you're testing for your ANCC. Remember the ruling of 2-2-1. Remove two options, remove two distractors, choose between two, and then choose the best answer. Great job, Naya. Karina, you're still here?
I'm still here.
Okay. You want to read the question, please?
Okay, you are a PMHNP working in a community health clinic. The clinic serves a diverse population, including individuals with mental. Oh, it's a different question.
Oh, sorry. It was Muba, sorry.
No.
Sorry about that.
It's okay. So the clinic serves a diverse population, including individuals with mental health concerns. As part of your role, you routinely assess the public health indicators that might impact the mental health of your patients. Today, you have a patient named Carrie who has been struggling with anxiety and depression. During the assessment, you decide to discuss some relevant public health indicators to better understand their potential influence on her mental health. You explain to Carrie that one important public health indicator to consider for mental health is social support. Which of the following statements accurately describes the role of social support in mental health? A, social support only comes from family members. So probably eliminate that because it says only. B, social support has no significant impact. Probably no, yeah. C, social support can provide emotional, practical, and informational assistance positively affecting mental well-being. So that one is, I can consider C. Social support is only relevant for physical health, not mental health. So I guess C, because the other one has the word only. Also D has the word only, and social support has the word no in B. So letter C is my answer.
So remember, guys, identify the question, When we say social support, so you're looking for a positive inquiry question. Look at letter A, only are distractors. Great job, Karina. Words with only are bad. And then remember, the longer the answer, the more concise they are. And that's your umbrella options. Am I correct? Remember that. Hot topic. Okay. Isn't it, guys? If you know your test taking strategy, you can nail this exam really good. May I call in? This is part of your domain one. Julie Kegler, you here?
Hi, I'm here.
You want to read the question and the answers?
Do you want me to read the scenario as well?
Please, the scenario and the
Okay,
part.
yeah. You are a PMHNP working in a memory care facility. One of your patients, Mr. J, is a 7-year-old man who has been showing progressive cognitive decline and behavioral changes over the past few months. He frequently forgets names, gets lost in familiar places, and has difficulty with tasks that were once routine for him. His family has also noticed that he has become more impulsive and socially inappropriate at times. As a PMHNP, you suspect that he might be experiencing a type of dementia. Question: what brain region is commonly associated with the behavioral changes, impulsivity, and social inappropriateness observed in patients with dementia, including Mr. J? A, hippocampus, B, occipital lobe, C, frontal lobe, or D, temporal lobe. I would choose C because the frontal lobe, sorry, I'm drawing a blank right now of kids in the background, is for more like cognition, memory.
So remember that. Final answer, guys, into the chat box. So remember, if you get the Q bank, you usually get a rational. So if you go, guys, to the side, remember the answer is the frontal lobe. Frontal lobe is responsible for our cognitive functions, including our decision making, right? Impulse control, that's where your frontal lobe's gonna be, okay? Occipital lobe is for vision. You have 2 eyes, so that's OO. Optic is occipital. While your hippocampus is like hippopotamus. That's how I remember it when I'm taking the exam. So that's more for memory. Temporal lobe, guys, is responsible for what? Touch, for hearing, right? And that's mostly for proprioception. So if you're gonna subscribe to our packages, you will get a question like this, and you will have a rationals that will tell you exactly why you got the answer or why you didn't get the right answers, and that's important. Okay. And we also do this like for the last minute preparation, which usually happens on a Saturday and Sunday. My next class gonna be January 13 and 14. If you guys are not doing anything on January 13 and 14, that will be the last minute preparation that we do for our program. 2 days intensive review, part of your package. Next. May I call in Joyce? Sorry, you again. You're still here? Yes. If not,
Hello.
yeah. Joyce, I'll give it to Sandra this time, if that is okay. Hi, Sandra.
Oh, yeah.
Sandra. Thank you, guys. Are you here, Sandra?
Yeah.
Hi, where are you from?
I'm from Dallas, Texas.
Dallas, Texas. Oh, wow. Okay. Great. If you want to read the question, it's the scenario in the question.
Okay. You're a psychiatric mental health nurse practitioner working in a community mental health center. You have been noticing inconsistencies in the treatment outcomes of patients with major depressive disorder. You believe that incorporating research-based interventions could improve patient outcomes. Question: what approach should the PMHNP consider to enhance the treatment outcomes for patients with MDD at the community mental health center? A, implementing traditional treatment methods only. B, relying solely on clinical experience. C, incorporating research utilization data into practice. D, ignoring research findings for individualized care. I will eliminate D, A, and B.
Okay.
And I
So
will choose
that's
the
taking
answer C.
strategies, words with what again? Only? Or basically check options?
Yeah, because it limits everything, is an all and only all or nothing answer. So that eliminated A. D. Usually we're not supposed to ignore research findings, for we're supposed to take those into consideration as well. And then for B, it's also an all or nothing answer. So my answer will be C.
So remember, when you're looking for a positive answer, you're also looking for, or a positive inquiry question will yield a positive answer, right? So letter A, words with only, guys, they're bad options because only stands for what? They limit the answers and they quantify or generalize the answers. Next, relying solely sounds like also on clinical experience is a negative answer. Letter C, if we ignore research findings, are we making it correct or incorrect, guys? When we ignore research findings, then that's also a negative inquiry. So what is the only answer that is positive here? If we incorporate research utilization data into practice, and that's the only answer here that is positive. So remember, positive equals positive. Inquiry, you also need to look for a positive answer. Great job, everyone. You guys are doing well with practice questions. Okay, next. Everybody good? Sorry for the overtime today. Another one. Let's do this question. Okay, this is very important. Uju Makindi, if you want to unmute yourself. Are you here, Uju? If not, Jacqueline Samoa. Or I'll be the one reading it. So what does PICUT stands for, which is your evidence-based practice, guys? What does PICUT stands for, which is used for evidence-based practice? Type in your answer into the chat box. So what is PICOT? Remember that? That will be your population, intervention, comparison, and outcome in time bound. So how do we phrase it in a question, right? So probably this will be a case of using music therapy among dementia patient versus non-use of music therapy. So population is dementia patient. Intervention is the use of MT or music therapy versus no use of music therapy. The outcome is to decrease falls or decrease anxiety. And then the time bound is 3 months. So once you guys do your DNP, you guys need to take to make sure you know your PICOT. And this is like a cut and dry questions. So sometimes you could be faced with this particular questions. So you need to know the meaning of PICOT. You need to know the meaning of SBIRT. What is SBIRT? Screening, brief intervention, referral, and treatment or therapy. And you need to know the meaning of PDSA for your boards, okay? Plan, do, study, act. You need to know PICOT. Remember that. PDSA, PICOT, SBIRT. Make sure you guys know that. Screening is S. B is brief intervention. BI is brief intervention. R is referral. And T is therapy. Remember that, okay? SBIRT. Remember that. All right. Any question with our session for today? I could go over and over, but we have 106 slides to go. But those are practice questions that we can utilize for last minute prep. I'll just share the open forum. You guys have any questions? You guys, this is the perfect time to unmute. So what is next after your preparation? Will you guys be traveling to California soon? So I just want to flash our website once again. If you are not part of our Facebook community, please subscribe. I will leave my number here if you have questions about what we offer in the Past Review Center. Please reach out to me, or my email is here. If you need the preceptor, please reach out to me. Or if you know a friend that needs preceptor or starting their own practice or clinic, please tell them. I also mentored students that are wanting to do that. So guys, this is Past Review. We are accredited by BBNPT, BRN, and American Heart Association. If you need BLS, CPR, Pulse, ACLS, we also do that. So we're one-stop shop review course program. You can join our Facebook community. We post questions there and some inquiries. And how do you start with our review program? I know our class runs every weekend. I already posted our live masterclass sessions. January, February, March, April, May, up to December. Our PMHNP, FNP class are posted, usually done on the weekend. And our NCLEX Next Generation is also posted on our website. So we have every weekend classes for these classes. We have the package is only $349. I know it can be steep for some, just to be more than that, but it's on sale right now. We have the Q Bank, $39 only, used to be $69. And we also have the on-demand videos wherein you see me talking. You can place and pause the video only for $69. That's the video on demand. And then the Q Banks. And then if you're ready to take the one-to-one with me, like what Gil did, he did one-on-one prior to his exam. You could do either a 2 hours, a 3 hours, or 4 hours with me. Okay. And what we do go over is the going over some hot topics, some weakness that you have, and I will tell you if you're ready to take the boards or not. So basically, we sit down for that one. But one thing that I want you guys to remember, if you get the package, at least you get the review, the 2 days review, you get the Q Banks, you get 1 hour one-on-one, and you get the videos. So the package covers everything, but if you want to do it individually, you can get our videos only, you can get our Q Banks only, or you can get our one-on-one only. Or if you want, you can text me whatever bundle you want, and we can give you some discount codes. Okay. So once again, thank you so much. Happy holidays. Do you have any questions how we run our program? Once again, we have a 99% passing rate. The last one who took his boards, I think Naya, you know him. His name is Gil, right? So that's him.
Yes, I do.
Yes, he attended and got our package. He did Q Banks. He did our videos. He did our one-to-one, and he did the group review last week with me. So congratulations to Gil. He is the Psych NP that took the exam this week. So if Gil made it, Naya, you're next, and other Psych NPs out here. My number is there, and the website is very simplified. You just need to go to pastnp.com, very simplified, and we have some testimonials there too. Why you want to do your one-on-one? Please listen to the testimonials of the students, okay? And what we're gonna go over with our one-on-one is very critical. So once again, please text me if this appeals you. We have primary offerings and of course the last minute review. Most students that did our program once again pass on their first attempt, 99% passing guarantee. And we want to assure you that you have access to our course until you pass if you get our package. Okay. So this is January. She took the exam. If you know her,
I made it.
so basically
Oh gosh.
she will tell you exactly what
Dr. Morante, I finished the exam.
what you're
in
gonna expect during
2
your
hours
exam.
and
So please
45
listen to
minutes,
their
and that's already
testimonials.
including,
They are really
the
good
checking
ones.
of my flag. Um,
And then this is Vanessa, this is Brian, this is Princess, and OG and Polly. So I cater to different students, different learning types. So we want to make sure we get your kinesthetic, visual, all of that by doing this practice question. But one thing that I can assure you, we're here since 2015 and we have helped a lot of students and we have a passing guarantee in our program. So if you sign up during the holidays, you can book it now and then use it later. If you have questions, feel free to call me, okay? Yeah. Yes. Eddie says eye opener. Yes. Please book your classes to us, Joyce. Thank you. Any other questions that I can answer? Interested in taking the preceptor for the exam? Okay, Eddie, I'm here for you, okay? My number again is 661-888-0195. You can call me or text me if you have some clarity about what we offer. But we're here. Please tell your classmates too that we exist because we also get our students from referral from previous students that I help out to coach. Okay. So once again, join our TikTok, join our Facebook. You guys can subscribe to our website too. For free classes, we'll let you know when's the next one. But basically on the weekend, because Monday to Friday, Joyce knows this. I have a are you sending the recording to everyone? Yes. To the expect your email. I'll send a recording. You can forward it to your classmates too. Okay.
What's your number again, please?
661-888-0195. Jacqueline,
Oh,
any code, just text me that you attended the class.
0195. Thank you.
Yes, Karina, if you got the package, you have a 1 hour one-on-one with me. Okay. So if you book the package, it comes with a one-on-one. Okay. So save your calendar. I will be seeing you January 13 to 14 for the last minute preparation. That's the 2 days, 6 hours class, 3 hours Saturday, 3 hours Sunday. That's why we do it back to back. So please save the date for any dates that appeals to you here. So Naya, you graduate in February. Yes, come back on February again. You're more than welcome. Yeah, Marie Claire Osorio, please do that one. So once again, get our package, QBank. You can get them individually, but I think you're gonna save if you get the whole package at on time. So Flix Crash Course and QBanks are available. Yes, I will send the recording, guys. And please make sure, yes, Anna B, do you have a course for LBN? Yes, we have NCLEX Next Generation and also BLS, CPR, and even IV therapy class, and even RN certification for med-surg and gerontology. So we have everything here. We want to be one-stop shop. Our NCLEX Next Generation is here too. Will question bank different between ANP and ANCC? Esther, they have the same course item outline. The only difference is AANP, they don't do a lot of research. ANCC love to ask those research questions. The ones that I showed you, PICOT, they showed you evidence-based practice. They love to ask.
oh Lord.
Okay. All right, Aviola, thank you so much. I'll send guys the recording for this one. And please feel free to tell your classmates I exist. I'm here to help them out. And your teachers, if ever they have some students struggling with the course, please let me know. My goal is to produce a lot of psych NP so we can help each other out in helping these patients that are struggling with mental health. So please watch out for our next free live class, but probably tell your classmates 13 and 14 will be my next last minute prep. And what do I do is give you guys the tools in a condensed manner. So you don't need to read the purple book, attend my classes, you'll be good. Okay? Thank you. So once again, visit our website and our Facebook community. We're here for you, okay? Thank you, Marie-Claire. All right. Have a wonderful day. I'm staying for another 5 minutes for any last minute questions. Thank you. Happy holidays. Merry Christmas, everyone. I appreciate all of you coming in to this platform. Okay. I will see all of you guys on the classes. And yes, Marie-Claire, proud to be Pinoy. Yes, I'm Filipino. Coming from Philippines, so I understand if you are an ESL like me, English as second language, I'll help you out to pass this board. Okay. Mrs. Sorio, yes, you work with Dr. Tan and Dr. Homer. Great. Okay. Annie Reggie, yes, we send email to the next free sessions. Yeah, we'll make sure. Just subscribe to our TikTok, Instagram, and our Facebook community. I'll announce there again our next class. Probably you can talk about neurotransmitters, basic drugs, and stuff like that. Okay. All right. Take care. Fiji, you have a question?
Yes, I have a question. So I probably have like 2 more semesters before I graduate because I'm doing dual. I'm doing my DNP at the same time as the psych mental health. Do you have a package where you can just like attend the live videos like what you did today to
Like
help?
on demand review? Yes, that's the Flix program right here. It's only $69. So that's
Okay,
the crash course on demand.
Okay, it's pre-recorded.
Yes, it's pre-recorded. Okay.
Okay, and it covers like all the domains and everything
5
already in there?
domains, and then also the high yield hot topics are there too.
Okay, you recommend doing that while you're still in school if you feel like you're
I
not
think so. If
getting.
you're taking like an exit exam, most students says our Flix crash course helps them out to pass their exit exam, like before they take the boards.
Okay.
So you
All
can
right.
do the crash course and you can do the Q bank to help you out with your exit exam. Okay.
Okay. Thank you so much.
Yes, Michael, I have your email. If you did not receive any recording within this week, please text me.
Okay, great. Thank you, Dr. Morante.
And please share what we offer with your classmates and your teachers. It helps us a lot with our marketing. And I think I put my program since 2015 to be outstanding. And that makes us separate with others because we're one-stop shop. Okay? We just don't do classes, we do everything for the students. Thank you, Naya. Does your QBank expires, Naya? As long as you subscribe to our QBanks, then you can cancel anytime. Okay? It's only 39. Yes.
Approximately.
You're subscribed to it. Okay.
Dr. Morante, approximately how many questions roughly are in the QBank?
I think 1,000, and we're updating it, probably 1,000 to 1,200. Don't quote me. I'll double check for you, Michael.
That's great. Thank you.
Yes. Only $39. So I think it's a win-win situation. You can cancel anything.
Definitely. Thanks.
Thank you, Michael.
Thank you.
So once again, happy holidays. Thank you. I will see all of you after the holidays probably. Eat something, eat some good food, and appreciate all of you, okay? See you in the next classes, okay? Once again, 2024 calendar is out for you guys.
Thank you so much, Dr.
Thank
Morante.
you, Mr. Sorio. I'll
More
touch
power.
base with you. Okay. Thank you. Thank you, Jacqueline. Thank you, Janet, Jessica. Thank you so much. You're amazing. Michael, thank you. Denver, thank you. Yes, Jessica, yes.